There are three parts to a pelvic or low back problem. The first part is an underlying structural or joint problem. The second part is muscle imbalance or weakness, including muscle trigger points. And the third is a non-functioning core. We're going to be looking for all three. When we look at any joint issues, typically the sacroiliac joint is the problem, including the low lumbar spine or lower segments of the lumbar spine or low back. We'll find stiffness and pain to these joints. That is the underlying cause. That needs to be treated through manual manipulation, joint work. The second is the muscle imbalance. When you have an SI joint or sacroiliac joint problem, what happens is the walking muscles, the gluteus medius and minimus, these are hip abducting muscles. They lift the whole body when you put weight on the same leg. And these are very, very strong muscles. Typically when we test them out for strength, we see a couple things. When the person tries to raise their knee up while in side lying, the whole back will turn as well. That's a sign of weakness. Typically anywhere from 50% to down to 15 to 20% of the actual strength is what we find. We find muscle trigger points in the gluteus medius and minimus as well. Now, the gluteus medius and minimus, the hip abductors, they become a weak and secondary firing hip abducting muscle, and they're supposed to be the first and the primary. When they become the second, the tensor fasciae lata, or the TFL, takes over. Now this muscle attaches to the iliotibial band, the IT band. That's where we get a lot of our lateral thigh, outside thigh pain and tension. What happens is this muscle is pulling more, trying to do its job, or the hip abduction job, but it's not really designed for that. It can do it, but it's like putting a wide receiver in a linebacker position. Yeah, there's a body there, it's just not going to work very well. So you develop adhesions between the anterior and posterior front and back border of the IT band with the fascia that surrounds the thigh. That's why you have pain and tension, and the feeling and the need to roll or try and massage that area. Now, that tension pulls on the knee, can create inflammation and swelling. That fluid on the knee, and we can confirm this with diagnostic ultrasound, we'll see some dark areas when we take a look at this area. That swelling will shut off the quadriceps. When that happens, the weakness and the lack of control of the knee, the calf muscles, specifically the soleus calf muscle, takes over because it's a knee stabilizing muscle. You can develop trigger points in the calf muscles, the soleus. Check for that. When the soleus is involved, you can get Achilles tendonitis as well as other foot and ankle problems on top of that. So that's the chain of events. SI joint problem, muscle firing imbalance, can include the hip flexors and the trunk muscles as well, the quadratus lumborum. The biggest take home is the gluteus medius and minimus and the tensor fasciae lata. They reverse roles. The TFL attaches to the iliotibial band, creating tension. Adhesions form, tightness, pulling on the outside of the knee can over time cause some knee arthritis if left too long. That swelling on the knee shuts down the quadriceps. The soleus takes over. It works a little bit too much. It develops trigger points, and down the chain it goes. Well, let's talk about treatment. We're going to be looking at treating the joint or underlying cause first, dealing with the soft tissue restrictions and the trigger points. Dry needling is a great option for this. And then finally, we need to check the core. Anytime you have outside thigh pain, hip pain, back pain, your core is inhibited. The best way to check the core, check to see if it's working, is through diagnostic ultrasound. We want to see the core, see if it's functioning. While we see the core, we can also work in training. So we can do the training while looking at how your core is functioning at the same time. Having a good functioning core prevents you from re-injuring this whole system afterwards. The young runner that we're working with, Noah, looking and see the different parts of the story. But once we treated the underlying cause, the joint issues, we addressed the muscles and the tension, the iliotibial band tension, the gluteal trigger points. He was feeling a lot better. He didn't have pain with running. He was able to actually increase his speed by the end of a race. The problem was he kept going backwards a little bit. Tested his core out, did not have a functioning core as a healthy 16-year-old athlete. Started core training, and now he is going further, faster. His times are getting much better. He is sprinting to the end, the finish line. And so core function is important to reduce that re-injury.